It is a turning point. For the last 5 years, we've documented stagnation in the reduction of malaria burden in Africa. Between 2000 and 2015, the rate of reduction was like 9 percentage points every 5 years. But in the last 5 years, it was 1 percentage point. We were so alarmed that we launched what we call Rethinking Malaria. What do we do differently to get a different result by 2030? And now this vaccine comes in. It's part of the game changers we are looking forward to. So introducing this vaccine as part of other arsenals against malaria, not as a replacement, as part of the malaria arsenal, we are happy to support countries to deploy it, including in combination with other interventions.
The vaccine has a 30% efficacy rate, low when it compares to other childhood vaccines. What is your reaction?
But we are happy that scientists have been able to catch the parasite in its game and have developed this RTS S vaccine that can attack the most common parasite in Africa, Plasmodium falciparum in the blood stage, and therefore hopefully prevent many cases, and more importantly, prevent 40 out of 100 deaths. If one of the 100 that will die is your child, but of course you will jump for the vaccine. And that's what we are saying. We have a vaccine that is effective, especially when combined with other interventions like seasonal malaria chemoprevention. It goes up to 70%. We want to deploy this vaccine. At the same time, support ongoing work for a second generation of malaria vaccines. Like COVID has taught us, we can deploy 3 vaccines at the same time, 4 vaccines at the same time. So as soon as we have additional vaccines and they are approved, we will deploy what is safe and effective. And that's what we are doing with this vaccine.
The vaccine was rolled out in a pilot program in 3 countries, Ghana, Kenya, and Malawi, for about 2 years. What strategies have shown to be successful in ensuring that parents who live in remote villages adhere to vaccine schedule? Because with 4 doses, it's not always easy to have the commitment or to have the means to commit.
That's true. That is why the piloting is still going on, especially for the 4th dose, to bring information on some of the issues that may impact coverage with the vaccine. We know that people in communities will invest anything to protect their children. It's about communication. But the piloting did not adopt any special strategy, just the routine immunization strategy. The routine communication strategy was what was deployed because we wanted to make sure that the routine system can deliver this vaccine. But going forward, I believe that introducing malaria vaccines, scaling it up in countries, should have a communication component. It will be a comprehensive communication component that advocates for vaccination in children, all vaccines.
Will it be introduced as part of a routine immunization at some point, do you think?
Certainly. The details are being looked at. For instance, we are looking at malaria had adopted a strategy of tailoring intervention. Look at the prevalence of malaria, look at the burden of malaria, and tailor the best interventions for districts and provinces in that country and in all countries. We do have supply situations. We think that in 2 years, there will be enough supply. At this point in time, we're working with partners like Gavi and others to look at how to ensure that this vaccine is made available.
And finally, I would like your thoughts, if possible, on what is happening in Burkina Faso right now. The researchers have found another vaccine that is more than 70% effective in clinical trials, which are still ongoing.
Every effective and safe vaccine in Africa for malaria will be deployed. So the work in Burkina Faso, when they are ready, they will submit their data set to the WHO for review. Again, like we brought together SAGE and Malaria Policy Advisory Group to work together to review evidence and propose adoption or otherwise. So again, also there is ongoing work on mRNA malaria vaccine. That is welcome. There are other vaccines in the pipeline. So any tool, any malaria tool, be it vaccine or any other innovation is welcome. We will deploy it if it's safe and efficacious.
Dr. Akpaka Kalu, thank you so much. We appreciate your time.
Thank you.